Hello and good afternoon, everyone. Welcome to our ninth session of Unsung Heroes, wherein we introduce optometrists and give them a recognition who are working continuously throughout their life in the rural areas. So now we have with us Mr. Jitendra Kumar, Mr. Sagar Pawar, and Mr. Saravanan with us in the session. Let me introduce you our panelists for the session. Mr. Jitendra Kumar has graduated from Shankara College of Optometry and completed his post-graduation in optometry from Chitkara University. He also has degree of Bachelor of Science with Physics as his honors subject earlier, along with MCA and MBA. So before coming into the field of optometry, he has worked as sales officer in Sun Pharmaceutical Industries. He has also worked as a study coordinator in National ROP project by AIMS, New Delhi, and currently he is head of optometry department at Trilochan Netralaya at Sambalpur, Odisha. We welcome you, Jitendra. And next we have Mr. Sagar Pawar, who is a senior optometrist, and he has completed his bachelor's in optometry from HP Desai College of Optometry, Pune in 2015, and he has worked over 9 years in the field of optometry. Over the years, Mr. Sagar has gained in-depth knowledge on screening, prescription of spectacles, dispensing, contact lens, and counseling patients. Around August 2019, Mr. Sagar moved to public eye health domain with his role as senior optometrist for the Akalkot Vision Center, which is managed by TDMA's HP Desai Hospital, and it is supported by Standard Chartered Bank, When Giving Foundation, and Mission for Vision. We welcome you, Sagar sir.
Thank you, madam.
And next we have Mr. Saravanan. Mr. Saravanan has completed his B.Optom from SRMIST in 2016 and pursued his work in Integrated Fellowship Clinical Optometry from AEC. He completed his M.Optom from Achyuta Institute of Optometry in 2001. He has been instrumental in conducting community outreach programs at AEC. Under his supervision, over 150,000 students have been benefited under various school vision programs in the last 7 years. His clinical interest is specialty contact lenses, and Mr. Saravanan is currently working as academic officer and faculty at Achyuta Institute of Optometry, Erode. We welcome you, Saravanan. Now, I would like to request Mr. Jitendra to introduce himself if I have missed out on anything.
Thank you for the introduction, ma'am. And this is Jitendra Kumar Sahu. I have completed my bachelor in optometry from Shankara College of Optometry. Also completed my master's from Chitkara University. Before coming to this course of optometry, also I have two master degree. That is one master in computer application along with master in business administrator as HR and marketing as my specialization. So this is a short introduction. Currently, I am heading the department of optometry at Trilochan Netralaya, Odisha.
That's great to hear from you, Jitendra. Next, I would like to ask Sagar ji, sir, introduce Kavaya.
Myself, Sagar Pawar. Thank you for first to give me opportunity to this section. Myself, Sagar Pawar. I am Akalkot resident in which is in Solapur district of Maharashtra. Last 5 years, I am working as a senior optometrist in Akalkot Vision Center. My completed optometry HP Desai Hospital. Akalkot Vision Center is 285 kilometers away from base hospital, which is HP Desai Hospital. Okay. Thank you.
Thank you, and we welcome you, sir. Next, we have Saravanan on board.
Good afternoon, all. Thanks for the short and precise introduction. Thanks to the Optometry Council of India for giving me as an opportunity to explore ourselves in the to the young budding optometrists to tell about who we are and what are the scope in community optometry and serving the unreached population. So we'll talk in brief in the upcoming slots.
So thank you all. Now let us begin the inspiring talk from our unsung heroes, and we'll start with the panel discussion with Mr. Jitendra. So Jitendra, what inspired you to become an optometrist, although you have an MBA in HR and marketing?
Actually, this is an interesting question, ma'am. Actually, there is a long story behind it. I want to consider it. After having an MBA in HR and marketing, I have joined as an administrative officer in the same hospital where right now I am working. So our hospital has a strong tie-up with Singapore National Eye Hospital. So this Singapore National Eye Hospital people used to come here once in a year to enhance our clinical skill. The same year when I have joined as an administrative officer, the same people came here and they are giving talks. So while giving talks, they used to take classes for the allied health people. And as we are working in a very remote places, so our allied health people knowledge is not up to mark to learn English. So I clearly remember Mr. Muhammad Farooq is my first optometry teacher. There, he taught me all the clinical setups. I was working as a translator. So he will teach me all the clinical setup and I will teach all the clinical things to my students. So to the allied health people. From there, my optometry journey started. After that, I have received an offer from my chairman sir that whether you can go for optometry for 4 years or not. So without any further delay, I told that yes, I can go for learning optometry because this is much more interesting than administrative job. That's why my job is totally shifted from management background to clinical background.
That's very nice to hear from you. So my next question is for Mr. Sagar. Sir, how do you arrange community camps and what all examinations do you do on site and while you're working in the remote areas?
Okay. जैसे कि हम विजन सेंटर में 3 लोग हैं, मैं खुद ऑप्टोमेट्रिस्ट हूँ, मेरे साथ और 2 कम्युनिटी हेल्थ वर्कर्स हैं। तो जहाँ पे हम कैंप लेने वाले हैं उससे हर हफ्ते में फ्राइडे को हम कैंप करते हैं। तो पहले कैंप के 3 दिन पहले हमारे जो कम्युनिटी हेल्थ वर्कर है वो उस गांव में जाते हैं और उस गांव के जो मुखिया सरपंच है, जो प्राथमिक आरोग्य केंद्र के जो कर्मचारी है या और कोई सरकारी अधिकारी है, उनके साथ मीटिंग लेके कैंप का अरेंजमेंट फाइनल करते हैं। और उसके बाद जो गांव में हर घर के जाके कम्युनिटी हेल्थ वर्कर्स उस बेसिक एग्जामिनेशन करते हैं और जिस जरूरतमंद पेशेंट रहते हैं उन्हें कैंप का जगह और स्थान और समय बताते हैं और वहां पे आने के लिए बोलते हैं। और उसके बाद हम जो हमारी पूरी टीम है फ्राइडे को हम जाते हैं और कैंप के जगह कैंप शुरू करते हैं। तो जो 2 कम्युनिटी हेल्थ वर्कर्स है तो वो दोनों पेशेंट मैनेजमेंट करते हैं, क्राउड मैनेजमेंट करते हैं और रजिस्ट्रेशन करते हैं, काउंसलिंग करते हैं और मैं आई चेकअप का हैंडल करता हूँ। तो इस तरह हम कैंप शुरुआत करते हैं। तो कैंप में हम टॉर्च लाइट एग्जामिनेशन करते हैं, विजुअल एक्यूटी टेस्ट करते हैं, रिफ्रैक्शन करते हैं और कुछ कैटरेक्ट सर्जरी और कोई बड़ी बीमारी है आंखों की तो हमें उनको रेफर करते हैं। तो इस तरह हम कैंप करते हैं, अरेंजमेंट करते हैं।
Okay, thank you so much, sir. It is very important for us before organizing a camp that we need to take permissions from the panchayat and all the respective members for arrangement of the camp, and also to spread awareness. Going for each house and spreading awareness is very important. So that is how we receive patients coming in for the camps. So that is one big initiative that Sagarji and his team does it very promptly. Thank you, sir. Now my next question is to Mr. Saravanan. So being working in both hospital and optometry institute, how do you inspire students to attend camps in the remote areas, Saravanan?
No, the advantage of being working in an institute and eye care the main challenge is the manpower selection, the skilled manpower selection for any camp. So when you work in institute alone, you will not have a sufficient amount of trained manpower to take into the camp. So the advantage of working in institute and iCare is you will be knowing, and you don't require 2-3 approvals or hierarchy to get the students from the institute or from the iCare for the camp, because it's two-way balanced. We can take the employee of an iCare for this public service, and you can replace the student in the from the institute for that same service. So the straight answer to the question, how would I inspire in the sense, basically it's a difficult thing, because what happens is in the hospital setup, we ask them to do meticulous workup, the retinoscopy, ophthalmoscopy, the fundus evaluation, the anti-segment evaluation, everything in a proper way to document and to record and for further treatment. Whereas in camp setup, the same teacher or the same tutor ask the students to take a short, very minute shortcuts for time being, because the crowd management has to be done. So everything cannot be done. So two-way, that is the one downside of being in both the institute. I would not say downside, but it is difficult. The same teacher teaches the good thing, ethical thing, and same teacher teaches the shortcut way also. Number one. Number 2 point is, how do I inspire is, so when you go for a community outreach, you are becoming, as I always, the Lakshmi madam says me, so your face become familiar. So you go to that village. So when you walk in, they will recognize you. Oh, this person has come for camp. He has given me vision. He has given me sight in terms of cataract surgery. He has given me drops. So they will not know exactly what the ophthalmologist does, but the camp coordinator or the person who interacts more with the village will have the local vibe, so that when they walk in or when they go to the street, when they go to the local market, so the local people get recognized you. So you are a small politician in your village. So that inspiration you will have. You can have that initial connect with the public people as an iCare worker. So that's how I inspire students. And definitely one inspiration is what you do is you come a Sunday camp and you take another day off, if that is possible. So that is one thing they might expect of, but we don't give that, but they might expect of. So those are things, and the more amount of examination chair time, they can do haram-se procedures like the retinoscopy or ophthalmoscopy, so that they can take time and examine the patient. These are the few points where I inspire the young students to come and attend the camps.
And I'm sure the students would enjoy the journey going to the camp, like a small trip for them and all that, right?
Yeah, definitely. So definitely when they feel the super top position person, if they don't come to camp, they'll be very much happy, because when they come off from the camp, so they will go and have fun. They'll go and have their tea time, things like that. Then they'll take the selfies. So things like that. Yes, it is a relaxation session from the routine hospital practice or from the institute practice. I wonder sometimes the college time starts at 9 o'clock. They usually come at 9:10, 9:05, 9:15. But when you say camp at 6 o'clock, they come at 5:30. I was wondering how it is possible. The only thing is the journey. They are traveling. These makes them more, enthusiastic, and they are in the impression of they are going to learn something new what they are not in the institute. So definitely this journey of community outreach, more of younger generation, we tell that they are lazy and things like that, but they come even 4 o'clock, 3 o'clock, they're ready to come and attend the camp, even on Sundays, even on government holidays. So I usually get at least 3 months, 4 months prior notice from the students, like I wanted to come up, I wanted to attend this camp, that camp, can you please put my name in this, like that.
Yes,
so this all happens, yeah.
Thank you, Saravanan. And my next question to Mr. Jitendra. So, Jitendra, you have taken a long break from your work to study optometry. So, how did you manage your family, and how do you feel going back to your place and serving your community?
Okay, ma'am. There are two questions: how you are managing your family, and second one is how you after going to your workplace. So, first question, while I'm coming to how you are managing your family. First of all, while I have received a offer for studying 4 years, I was getting my as usual salary as stipend. So there is no financial burden on me, first of all. So managing family, yeah, and with annual increment of facilities also. So financial problem, there is no at all financial problem on me. If it coming to personal problem, personal and family problem, yes, there are, of course. Because while I was doing my first year. So my uncle expired. I am the only one male guy available in my family. So it was not possible for me to continue my study. I was totally depressed. Some of my teachers, once everyone make me understand the importance of optometry. Then once again, I have continued my study. And along with that, in the initial period of second year, I got married. And in third year, have my baby. So these all live events are going on. So managing family, it was slightly bit difficult while during the course. So while coming to the workplace, well, I have written because before going to the course, there is no such, I have no such idea about optometry in rural areas. So while returning, I saw that there are many opportunities which I can prove myself while working in the community. I have introduced low vision services. I have introduced vision therapy services. I have introduced contact lens services also. So this way, while work returning back the a lot of expectation from the organization also, and your thought process also totally changed how you are penetrating to the community, how you are reaching to the onlys. So if you see the western odisha health facility, it's not up to the mark, so we should not think about the general eye care. So here eye care is a daydream. So while eye care is a daydream and you are penetrating every super specialty to the honest people, so this is a great challenge actually. So this way, while returning, it was somehow going on fine. Like that, my journey while returning.
That's nice to hear, Jitendra. The amount of service that you're offering right now to your community is commendable. You have introduced specialty optometry in your community, and that is really nice of you. And now, next question is to Mr. Sagar. So, how do you explain to patients about their eye condition, and how do you convince parents or children that they're supposed to wear glasses or they have to go through surgery like cataract? तो कैसे कन्विंस करते हैं सर?
इन आई कंडीशन में 80% विजन सेंटर में ट्रीटेबल है और 20% अपन रेफर करते हैं जो कैटरेक्ट सर्जरी या अदर आई कंडीशन के बाद। तो जैसे कि विजन सेंटर या कैंप में अपन जब उनको चश्मे का नंबर देते हैं रिफ्रैक्टिव एरर, जो चश्मे के चश्मा लगाने के बाद आपको जो दिखेगा वो चश्मा नहीं पहनने के बाद आपको जो दिक्कत आती है वो कंपैरिजन करते हैं कि विद स्पेक्स और विदाउट स्पेक्स, तो उनको समझ में आ जाता है। और तो दूसरा है जो सर्जरी है जिसके आंखों का प्रॉब्लम्स है, बड़ा प्रॉब्लम है या और सर्जरी है कैटरेक्ट सर्जरी वगैरह, तो उन पेशेंट को दिखने में दिक्कत आती है, तो उनको जो उनका खुद का दूसरे आंख जो अच्छी आंख है वो और जो जिसको कम दिखता है उस आंख का कंपैरिजन करने के बाद उनको समझ में आता है कि इसकी जरूरत है ऑपरेशन। तो इस तरह हम और जब भी हमारे जो सक्सेस इसके पहले जो सर्जरी हुआ है या कोई चश्मा पहना है तो उस पेशेंट का जो एक्सपीरियंस है वो खुद बताते हैं और पेशेंट को हम मिलाते हैं कि उनका सर्जरी के बाद और चश्मे का नंबर पहनने के बाद जो सेटिस्फेक्शन है वो वहाँ पे उनको समझ में आता है। तो इस तरह हम उनको कन्विंस करते हैं और उनके जो चश्मा अगर नंबर है, उनको जो चश्मा है उसका ट्रायल हम फ्रेम और ट्रायल ग्लास वहीं पे हम उनको दिखाते हैं कि कौन से ग्लास है और कुछ फ्रेम्स है, तो उस हिसाब से उनको हम कन्विंस करते हैं। और हमारा जो विजन असिस्टेंट है वो भी काउंसलिंग करता है चश्मा लेने के लिए, रिफ्रैक्टिव एरर जिसका है, और सर्जरी के बारे में भी वही जिसका जो सक्सेस हुआ है, जो सर्जरी हुआ है उनका जो अनुभव है वो उनके साथ हम शेयर करते हैं, तो वो भी मान जाते हैं और इस तरह कन्विंस हो जाते हैं।
ओके सर, थैंक यू सो मच। क्योंकि
और एक हमारे यहाँ पे विजन चार्ट है, एलईडी विजन चार्ट है, तो उसमें भी कुछ एजुकेशन मटेरियल है जो आंखों के बारे में वगैरह वो भी हम उनको दिखाते हैं, तो वो भी उनको समझ में आ जाता है।
ओके, थैंक यू सर। क्योंकि लोगों में अवेयरनेस लाना बहुत इम्पोर्टेंट है। माय नेक्स्ट क्वेश्चन इज टू Sarvanam. So can you share your experience about conducting school screening, especially helping the rural population?
So usually we do a lot of the private school, which means the non-government or non-government aided the school for the last 15 years. We have been doing the entrance for the permission approval is easy. So you need to get two approvals. One is the internal approval where your management should have the same thought process what you have. In a way, I am lucky in a place where my management is for the community activities, and they do a lot of community activities way back from the UK, and they started it. So that permission, internal permission, is the challenge. So your thought process you might think as an optometrist you need to do so much to the community, but if your management is not allowing, because if they think in terms of commercial aspect, so it will be very difficult, because once you do the camp, the expense is somewhere between 5,000 to 10,000, and if they ask how much turned around in terms of monetary, it is difficult. So that is one internal challenge is there. And second point is we have the external permission from the governments. So even if it is a private school, for example, if I examine XY parents' children, and if I write them recheck at hospital or it is abnormal, then they will start cribbing, or they'll start fighting to the school headmasters or to the teachers who are there to say my child is not normal or something like that. So that you need to be very careful. So the permission, I'm saying about permission part, you need to get, and you need to tell them in a convincing way that vision screening is important as the dental or the ear this thing is. Then off late, what happened is the central board itself approved saying that every year the eye screening is mandatory, certificate is mandatory to upgrade from one class to other class. So that challenges we have came across. And one more challenge we have as an experience we have is the government school is very, very difficult to get approvals. The government or government aided schools. In a way, I would like to take this opportunity and thank the Optometry Council of India, because we have got an opportunity 2 years back in terms of Vision for Cause or the SL or the Vision Foundation, the Experience Vision Foundation. We have got opportunities. So that's where it triggered us to niche the government and government aided school. The difficulty in government school is, though you give glasses free of cost, things like this, the compliance is very poor. That is the one challenge. We as an optometrist, we are thinking the service is done. I have done the refraction and we have given the glasses and we come back, and we might sit relaxed and we think that child has got the vision back. But after 15 days or 1 month, you go for a compliance follow-up, you might be wondering only 1% to 2% of the child use the glasses. So that is the one upset factor. I think everybody would have gone through the same thing. Even in terms of cataract surgery, you advise a patient for cataract, but the turnaround is maximum of 10 to 15% of the people come to your base hospital and does the cataract and they go back. So the convincing factor is the real challenge. As the Jitendra sir has rightly said, that chair time for counseling is very much needed. In terms of that is the experience I want to share. The number of camps you do is not the primary thing. The number of camps might be less, the number of screening might be less, but the number of conversion to treatment or management should have at least 60% efficacy, so that what you've done is more reachable to the unreached population.
Okay. Thank you, Saravanan. We understand the challenges, but in spite of facing all these challenges, we are proud that the work is still going on, that is helping rural population with eye health. Thank you so much. And my next question is Mr. Jitendra. So how do you think you are giving a better service to your community by upgrading to masters in optometry?
Yeah, ma'am, actually, if you will see in India scenario, Odisha scenario definitely, and if you will see Indian scenario, in every optometrist, those who quality optometrist, they used to work in the tier 1, tier 2 cities. If you will ask any intern where you are going to work, he is definitely going to tell that, he will tell any one name of the tier 1, tier 2 cities. No one is interested to work in the community especially. I would like to thank in this contact Sagar sir and Sarvanand sir. They are really hats up to both of them actually. You will get very rare number in the field of optometry actually, those who are interested to work in the community. So as an organization, if you will see, our organization is near about 15 years old. So we have 5 hospitals in 5 districts. One is at Sambalpur, one is at Banipadna, one is at Jagatsinghpur, one is at Bargat, one is at Jharsuguda. And also we have 5 vision centers. So while coming to the trained human issues, we are struggling a lot. So our chairman sir had a dream how to give proper care, eye care to the community. There is always a dream to give proper care and effective care and efficient care. In that regard, what we did, suppose where we are working right now, we are taking the 10 standard pass out girls. So we are giving +2 education, means PUC science education free of cost. Those who are securing above 75%, we are introducing them into BSc Optometry as a sponsored candidate. So while passing out, they can work for the society or work for the community, which is it will take some time, but at least you will not struggle for trained human issues. So in this regard, we are in the process of opening a BSc Optometry college at Sambalpur, our base hospital. So for training the optometry, train the trainer, suppose train the to produce new generation. So it is very much required to do the aim optom. That's the only reason why I have chosen, after having the bachelor degree, after having two masters also, I have interested for master in optometry. This is the only one reason.
Thank you, Jitendra. Probably this strategy can be applied across so that it will be easy to get optometrists to practice best standards, right? So my next question is to Sagarji. So what motivates you to continue to work in the community?
फर्स्ट तो मैं थैंक्स, मैं जहाँ पे अक्कलकोट विजन सेंटर है, मैं इधर ही पला बड़ा हूँ, तो इन्हीं लोगों में काम करने के लिए मैं बहुत प्रेरणा मिलती है और मेरे गांव वालों के लोगों के लिए काम करने के लिए और इसी तरह आगे काम करते रहने के लिए इन जो मेरा जो रोजगार है वो इधर ही मिला है। इस काम के लिए मुझे और बाहर जाने की जरूरत नहीं है, तो मुझे मेरे टाउन में ही मुझे विजन सेंटर चलाने के लिए, ये काम करने के लिए मुझे मौका मिला, तो इसके लिए मैं बहुत मोटिवेट हूँ। और दूसरा जो बोलते हैं, जो ऑपरेशन के पेशेंट रहते हैं या कोई चश्मे का चश्मा पहनते हैं, तो उनका जो सेकंड फॉलोअप के बाद जब आते हैं तो उनका जो खुशी रहती है या उनके परिवार वालों की जो खुशी रहती है, वो देख के मुझे और मोटिवेट होता है और काम करने का शक्ति मिलती है, तो इस तरह मुझे मोटिवेट होता है।
Thank you, sir. It is always a privilege and blessing to work in your own place where you've been born and you've been brought up in that place.
Yes, 100%.
My next question is to Mr. Saravanan. So, Saravanan, do camps motivate your students towards public health? And what kind of learning do students appreciate when they take part in camps?
Yeah, the second part I like to answer first. So what the students is more interested in attending a camps, what motivates them more is the amount of retinoscopy they perform. So the amount of chair time they have. So for example, when they examine a child 12 years old, they do all the tests from the visual acuity to the NP and all the binocular vision orthoptics workup. They will take 30-40 minutes. They will do slowly. That is not possible in a clinical setup where the paid patients are walking in. So number one. Number two, the amount of disease they look into it, because more of budding optometrists, they think that disease part is the glamour factor for them to learn. So the disease part, when they posted in the OPT, they are posted in each department, not in the whole department, like cornea or the glaucoma or the cataract. Whereas when they come to community outreach, we have the mini meals concept. We have everything from cornea to the retina coming from day morning to evening. They see every cases in one day itself. So they will not forget those cases rather than studying the same thing from books. So if they see the corneal ulcer, they will be able to correlate with the type of corneal ulcer, things like that. So they see everything. And the communication aspect, how to talk to a patient, how to take a proper history. So because all these patients, most of the times they would have walked into different camps, they would have undergone surgery, everything has gone absolutely wrong, and their vision will be like CF 1 HM plus. So the empathy part they can learn from the community outreach. So they will sit and listen what the patient is saying. So in communication, listening is more important. So that part that motivates them, and that will that goes deeper into their heart, that community optometry, the gap is more. So they think more of South Indian, the organization, like bigger organizations already there, and the community unreached areas are reached, but it is not like that. The gap is more, and as you rightly said, the working in your place where you're born and brought up with your local community is the blessing. What else you can have more than this service you can do. So that motivates them more. And I always tell to my team, whenever you go to a place, you always connect with the local people, because all these grandparents, grandmothers, grandfathers, they will not have anyone to tell their story. So you learn a lot of them, and they are 80, 90 years old. They will definitely have a lot of experience than we have. We as an optometrist go there, but you go and change as a human being. So they will tell a lot of stories. So we have seen people who lived with Mahatma Gandhiji. So those all are the few things where it keeps learning is always a continuous process. So keep learning. Every camp they learn at least one thing. So that is the straight one. And do camps motivate your students? Definitely. In public health, yes, because I always tell you are the decision maker. Whereas in a hospital setup, you will have somebody superior to you. They'll be guiding what to be done. But whereas in community outreach, you are the decision maker, whether this case can be treated or this case can be referred. If it is referred, it is an immediate referral or late referral. If it is referring to the base hospital or a tertiary care hospital. So this all decision making motivates them. And we do regularly a lot of these camps, even in school and even in a public health camp and diabetic retinopathy. And always community outreach, people think it is only cataract screening, but I would not accept that. Cataract, diabetic retinopathy, glaucoma, and more of refractive error. And sometimes we go for just for vision screening for drivers and visual task analysis and tell them it is job oriented, occupational related camps. So a lot of things are there. So definitely it motivates them because they are the boss there. So when they sit there and they take decision, it might go wrong. We are backing up them, but that motivates them a lot. So take up the decision and to organize a team, to make everything fall in place, to handle 10, 15 peoples, they should have that skill of handling, because sometimes they might become a management part in some hospital or any of the NGOs. So that leadership role they are learning in the community outreach. So those are the motivating factors they are learning.
Yes. I'm sure for the students and interns who are live with us on FB will agree with what Saravanan is talking about. Definitely it reduces chair time, and a lot of practice will make them perfect, and also it will give the students a lot of confidence once they participate in community eye screening. So thank you, Saravanan. My last set of question is a common question. We all know every journey is not about being pink and roses, but it also has few challenges that everybody would go through. So my question is to Jitendra, like what were the common challenges that was faced throughout your journey?
Very difficult question, actually, you will see. You will see the list is actually very long and it is very much difficult. So, of course, there are many challenges while we are going through. So, if you will see the challenge as an opportunity to prove yourself, then the definition of challenge actually differs from person to person. So, in my case, every time I used to see every challenge as an opportunity to prove myself whether I can do or I can't do. So if you see throughout my bachelor career and master's career, the one thing I used to face that because I was previously I was working. So my age and my classmate age quietly difficult, near about 10 to 13 year, 14 year difference. So while I have entered inside the class, sitting with a 13 to 14 years difference age group students, once again after having work life, once again you are going to student life. So that sudden change is slightly difficult for me to change. So somehow I have done, and it took me actually 2 to 3 months to settle down. And in this regard, this is the biggest challenge. If you'll see, I will tell in my career. And if you see family life, definitely there are many challenges because I am the single parent. My mother is only there. So my wife, my son, everywhere they are sitting at Odisha, and you are sitting and you are studying at Bangalore. It is taking a holiday because 70% attendance is required. So if you will not attend 80%, sorry, If I'm not 80% attendance is required, if you are not doing they will not give the call letter, everything like that. So these all, while giving time to family and your continuous study, the list is actually long. So this is the biggest challenge part I have faced. And if you will see in professional life, what is the challenge? Actually, if you will see where right now I am working, this is totally remote area. So in remote area, if any patient is coming with asthenic symptom, only a pair of glasses is more than sufficient. So penetrating to every doctor's mouth, every optometrist, to educate, to empower everyone, it is very much difficult. That these vision therapy services, low vision services, contact lens services, also there are many options available. So that penetration and that awareness among the community is also important, which is matters a lot. So if that awareness can be created in any optometrist, in any community, interior part especially, so the profession will explore like anything. This is from my part.
Thank you, Jitendra. So next we'll go on to Sagar sir. Sir, please tell us what were the common challenges that you had faced while conducting camps?
कैंप में कैसा होता है, कभी कभी 120 से 150 पेशेंट आते हैं, तो कभी कभी 70-60 पेशेंट आते हैं, तो जो फुटबॉल है वो कम होता है, तो वो एक चैलेंजेस है। कभी कभी क्या है, गांव वालों के लोगों में एक अंधश्रद्धा रहता है, तो इसी वजह से लोग नहीं आते। और कभी कभी क्या होता है, एक समाज का कैंप रखे हुए है, तो दूसरे समाज वाले बोलते हैं कि वो उनका है, हम नहीं जाएंगे उधर। तो इसकी वजह से हम क्या करते हैं कि सभी लोग आना चाहिए, वही जगह पे हम कैंप रखते हैं। बोले तो ग्राम पंचायत का जो ऑफिस रहता है, कार्यालय, वहाँ पे, या सभागृह रहता है, वहाँ पे हम कैंप रखते हैं। तो एक चैलेंजेस है। और दूसरा, जो हम ऑपरेशन के लिए अक्कलकोट जो विजन सेंटर है, इधर से हम पुणे को भेज देते हैं। तो जो गाड़ी में हम भेजते पेशेंट जो सर्जरी के लिए, तो सभी बुजुर्ग रहते हैं, कोई और थोड़ा सा यंग रहते हैं। तो जो बुजुर्ग बहुत ही, जिसको चलने को दिक्कत होती है या कुछ डिस्टर्ब रहते हैं, तो उनके साथ हम एक अटेंडेंट, उनके जो रिलेटिव्स रहते हैं, उनके साथ भेज देते हैं। तो सब लोग क्या, किसी पेशेंट के साथ अगर कोई रिलेटिव्स नहीं होता, तो वो बोलता है कि मेरे साथ भी चाहिए। तो ये चैलेंजेस है कि उनको हम कन्विंस नहीं कर सकते हैं, तो एक चैलेंजेस है। तो that's it.
Thank you, sir. Next, Saravanan. So what are the common challenges that you faced while conducting this screening camp?
And the biggest challenge I would always say is to have a competent team. You need to have a competent manpower. And on that morning, if you get a phone call from any of your team member, you should be making the second person ready for the same task. So your team, so without my strong team, definitely I might not be in this position now. So I always salute my team, because whenever the moment we say 9 o'clock that tomorrow is the camp, they are very much available for the camp. And the whole team, I'm not talking about the optometry team or the professional team or the nurses team, even the transport team should be available, because we should be at the right time for the camp to start. Even the data entry team, all those things, because we complete the camp by 4 o'clock, 5 o'clock evening, they'll be sitting until 9 o'clock, 10 o'clock and completing the data, and they'll be sending to the right officials. And number two is the challenge is to convince the management that you are doing the camp. So in that way, I am blessed, because my management and we have the same, Sarani madam, I have the same thought that to do a lot of community outreach, irrespective of the commercial aspect to come in. So we do camp without expecting anything. That is the one challenge. And third challenge I personally say is, as sir has said, the Jitendra sir has said, the trained professional is less. And before you go for a camp, you need to do a dry run, like mock-up you do inside the organization. You need to make your students as the patient, and you need to walk through what if so many patients are coming in, how would you like to take for. You need to have a strong workflow, or I would call it as a protocol, how to work, how many, so that you will be knowing exactly how many team members are required. Sometimes you take more team members and there will be no patients. Sometimes you'll take less team members and there will be more patients. So managing the team, number of people required, and managing the budget So budget is again a big challenge because the organization only give less amount of or this amount, apt amount of budget. You should be ensuring that is done in this amount. And if you do all these things, making the patient come into that place is the biggest challenge. You should be doing some amount of pamphlet distribution, auto announcement, or the any merchandising or any local shop advertisement to make sure the service is reached in that local area. Involve the local panchayat officers or involve the teachers, involve the local authorities to help that the camp is going to happen in this place. So you might have proper team, proper packed, proper workflow, everything. You might have landed the camp half an hour before. If there are no patient, then this camp is again a failure model. You should make sure there are good amount of patients. So internal marketing is also needed. So once you plan for a camp, at least 7 days prior, you give notice inside the vision centers or inside the institution that and make students involved. Let them give like 50-60 notice to them. Let them give the notice in their nearby surroundings in the radius where they live. So these all are the challenges where we have. So this all, as Jitendra sir said, everything is a challenge, but this all to be seen as an opportunities. Once you see this an opportunity, because nothing is cakewalk, everybody knows this. So when you work towards that, if your intention is right, then it will fall in place, but it will take time. If you would have done, I would have done almost 200 camps. But if tomorrow is a camp, then definitely I'll think what should not go wrong. What else should I think of? The most challenges is you might have missed some small 90D. You will not be able to examine the fundus. So the checklist of things to be taken, whether it is in proper condition, in transporting the staffs and transporting the instrument is also a challenge because the optics should not change in the slit lamp. The things what all you take from the hospital should have been replaced in right time. Those are small challenges you should have. So if you have a proper protocol, standard operative procedure, these all things will fall in a smooth place.
So in spite of all these challenges, Saravanan, do you think you feel satisfied at the end of the day working hard on all these challenges?
Excellent question. I would like to say a small story. A small boy who is 5 years.
Can you be a little bit more audible?
Yeah. Am I audible now?
Yes.
Yeah, I would like to say a small story. Erode is basically a part of Tamil Nadu. 20 years back, if you imagine, the population is almost 3 to 4 lakhs. Now it is almost 7 lakhs. It's more of 2 to 1.75 tier. I would not say tier 1 or tier 2. It is like 1.72. So Erode is a place where 20 years back, it is even more rural. So 5 years old boy, I remember the story. 5 years old boy is examined by an hospital, an eye hospital, which is 500 kilometers away from his place. He has got his eyes tested by a school screening program, where he is diagnosed with an high amount of astigmatism. Then his parents took him to an eye hospital, which is 500 kilometers away, just for glasses. I'm saying just for glasses, where in that district itself, they had almost 10 ophthalmologists available. They had taken the child to 500 kilometers and they have advised him to wear glasses. But again, the parents had second opinion, third opinion. The child has wear glasses at the age of 8. So 3 years delay. So slightly the child has become slight amblyopia, and after which they had undergone vision therapy, things like that. And the vision has become normal. And after which the child has done his 12th schooling and the child has done his optometry program, only to make sure this same incident should not happen to any of his surround rural population. So he done his bachelor program, he has done his master's, and now he is sitting in front of you. So that is the satisfaction factor for me. So I should make sure there should be no blindness because of unaffordability or lack of awareness. It's not like unreached. The service is getting reached, but whether they are coming back to your hospital for the right referral is the question. Whether they're taking your treatment, the convincing factor. So that is the main factor, I would say. The very much satisfied when some child is coming and saying to me or to Saranya madam that I'm seeing vision only because of your school screening program, it is a goosebumps to us. That day is enough. So we don't require any of the meal on that day. So when some child is saying, I'm seeing because of you, when they turn 18 years old, when we have seen and given glasses at the age of 5, so that is very much happiness. That is making us satisfied more than anything else, more than regular OPDs. And that is the reason we are still in this field.
So we are open for questions for participants who are live on FB. You all can ask our heroes any questions that you would like to ask. Before that, I would also like to ask Jitendra that whether all your sacrifices are worth it, and are you happy today that you are in this path serving your community?
Yes, ma'am. Definitely, I'm more happy than before because what happened while we were serving the community. One thing I want to tell: while going to the bed, you just tell yourself what you did today. If this question you ask every day while going to bed, definitely you will get an extra satisfaction which no other job can give. So this gives, ma'am, every day while you are searching what you did today, how many vision you have given today, that actually this is the satisfaction level. So I'm really very much satisfied with this profession, and yeah.
Thank you, Jitendra. So सागर जी आप क्या बोलेंगे कि आप satisfied हो, खुश हो?
Yes, ma'am, 100%. And thank you for giving me this opportunity to share my experience with all. And thank you, my organization, to HUDSI Hospital and support team Mission for Vision when giving foundation. Thank you, madam. That's it.
Okay. Thank you everybody for participating in this session. One question to all speakers is, what are all your opinions on how camps have changed across the time? So we'll start with Sarvanan.
Yeah, what I would feel is across time, what I'm seeing is previously the unskilled employees or the people who are just 10th standard passed have gone to the camps and they did their examination. Now that more amount of eye care professional like optometrist come into the play and they can give the treatment or the management in a better way. So that's how I see of late the more amount of organization is coming up, more amount of NGO is coming up for community outreach program, and they are liaising with the institute where the optometry schools are there. So the optometry school involvement is more. Previously, in 5 years before, I could not see this amount of optometry schools getting into the community outreach practice. So now I can see a lot of young optometry students or the young optometry practitioners are coming into the community outreach and they're willing to serve to the community. This is what I see in the last, for almost a decade, I can see a lot of difference in the camp setups. A lot of qualified people are coming and doing the treatment rather than just 10th passed or a lot of just an optical outlet. They might run optical outlet. They might do a camp only for commercial aspect. So those all things are broken, and now we have a lot of qualified people and to participate in the community outreach.
So what are your opinions, Jitendra?
Absolutely agree with Sarvanand sir. If you'll see 10 years before the screening camps, that totally now what screening camps are happening in day-to-day life, it is totally different because now what happened, that same thing, 10 student, 10th pass out student, they that means they used to go and they know only cataract, whether cataract is present or cataract is absent, whether to bring or not to bring. But while an optometrist is going for screening, he will see whether Oplas is positive or not. If Oplas is positive, what to do, when to do, whether terrorism should be done fast or cataract should be done fast. There are a lot of questions while we are going to the camp test they used to ask. So if you don't have that much of confidence, don't have that much of knowledge, it is not possible to penetrate inside the community refraction camp. That's why they will ask many more number of cases, many more number of questions. So if you know the cause, then you can give a satisfaction result to the community people first. Second thing, the referral. Suppose patient is having 10 years of diabetic. Patient is telling that I don't have an issue, I am seeing clearly. So only one optom or educated person can make them aware that after 10 years, it is better to have an eye checkup. So which was not happening previously. So this way, suppose a very good example, I used to tell that in my early days, I went to one camp and there is a small boy and he was very much interested for playing. So he was, so that happened -7 or -6, -7, -8 is refractive error. So he was very much interested for playing. No, he was not aware that whether I can play again or not. So a pair of contact lens, simply a pair of contact lens can change their view. So which was not available in the previous time. Now each and every solution and when to refer, where to refer, why to refer, every question can be answered as a screening person in the community outreach camp in nowadays. This is my view actually.
थैंक यू जितेंद्र। सागर जी, आप क्या बोलेंगे? आप सीनियर ऑप्टोमेट्रिस्ट है, तो इतने सालों में क्या क्या चेंजेस देखा है आपने स्क्रीनिंग कैंप्स में?
बहुत चेंजेस हो गए मैम। सभी को और सीखना पड़ेगा, क्योंकि जैसे जैसे हम आगे बढ़ते जा रहे हैं तो नया टेक्नोलॉजी बढ़ते जा रहे हैं, तो बहुत चैलेंजेस है। तो उसी तरह उसका सोल्यूशन भी अपने को निकालना पड़ेगा। तो जितना आप एक्सपीरियंस लोगे, कम्युनिटी में काम करोगे, लोगों के साथ एग्जामिनेशन करेंगे, तभी आपको समझ में आएगा। तो यही बोलना चाहता हूँ कि और वर्क करना चाहिए कम्युनिटी में, तो उनको इस हिसाब से काम करना चाहिए।
थैंक यू सर। टेक्नोलॉजी के हिसाब से अपडेट होना इज वेरी इंपॉर्टेंट। एंड ऑल्सो देयर इज अ क्वेश्चन टू Saravanan about how do you advise students who are completing their optometry degree to pursue their career in public health?
Very good, excellent question. So what I thought is, even now I'm thinking why I have not done masters in public health. So that is one option where if you want, there is two answer to that. If you wanted to straightly hit the public health, better do a masters in public health. If you wanted to continue in eye care, bachelor's in optometry is more than adequate to do an eye services. So you wanted to do a public health, there are a lot of organizations. I would like to name the organization like Save Sight Foundation, Orbis International, CBM Bangalore, or Optometry Council of India, or we have India Vision Institute, and we have a lot of other organizations where you can work as a public health provider. There your role will be optometrist, but you'll be learning all the aspects. Your day core activity will be public health. Daily you will be going for a community outreach, you'll be collecting data, you'll be getting grants from the different organization, and you'll be liaising with the different school of optometrists. So those all are the areas where you need to join, or you can join in a big organization. I would like to say big in the sense where you need to go and research where the community activity is highly there. You can join there, and you can join as a junior community with optometrist or things like that. You can go and help them in upgrading the quality of services provided. As Jitendra sir has rightly said, nobody's going to stop you to do a orthoptics workup in a community practice. In fact, you might have a long time to do that. So you can do that. You can do a dry eye workup in community activity rather than just referring a patient or just giving lubricant when patient is saying watering or dryness. You can do a dry eye workup. It doesn't take long time to do that. So those are the areas you can work. And these are the organization. You can find a lot of organization in and around India to work only as a community optometrist. Your role will be defined there and you'll be satisfied there. So the numbers of community activity done is higher. I'm not saying hospitals are not doing. The numbers might be slightly less. You can go on a tertiary hospital. Like if you wanted to name in North, there Dr. Shroff Eye Hospital does, HV Desi Eye Hospital does lot of eye community outreach programs. Shankara does lots of community outreach program, but always make sure when saying community is not only cataract. There are a lot more than cataract. So don't go and fall in the pit of cataract screener. You are supposed to screen a lot more than the cataract. As Jitendra said and sir said, diabetic retinopathy, glaucoma, even family counseling is needed for high myopic patients. So all these things are possible. So and you can go and liaise with the diabetologist in your local center, and you can go screen the retina. You can go and liaise with the lab centers, where the blood levels are checked, glucose levels are checked. So when the glucose levels are higher, you can do a short time the direct ophthalmoscopy examination, and you can ask the patient to come to a base hospital. Those all things are possible just sitting in your place.
Thank you, Saravanan. So there's another question. Say, for example, you have gone for a village for an eye camp, and you see already there is an eye camp that is being conducted. So how do you tackle this situation is the question. If anybody has come across this kind of situation, probably you can answer.
So I think if already, for example, last week someone has did the camp, and this week we are going and doing the same camp, isn't it?
Okay.
That is what the question is. It what that is what.
So the question is, you have already gone for a camp, but there is somebody else who is doing an eye camp there. So how do you tackle this situation is the question.
I would like to answer the question now.
Okay.
Because this has already happened. Actually, in day-to-day life, if you are having a camp, that announcement before, actually that camp is not happening on and sudden. So before that only it is already, that means that prachar and advertisement, every awareness that used to happen. So if somehow there are two camps in a village by two organizations, nothing to be worried. One village means at least 400 to 500 population is there. So in a camp, if you are getting 150 to more than 150, 100 participants, that is more than enough. First. Second, if there are two number of camps, people used to go where they are comfortable. If your place, if you have done the camp in the same village before, definitely people will prefer it. First. Second point, if you have taught and you have given, you have spent many time with the villagers. Many time means villagers means that campus, those who are coming to the camp. So suppose if a patient is coming and he has diabetes or he has glaucoma, father is suffering from, you have given enough time for glaucoma counseling, that patient, whether 2 or 3, many more organizations are coming into that village, definitely you will go to your organization only. So that quality, whatever you have given in your previous camp, that defines whether there are 3 more camps or 2 more camps or 1 more camp, that doesn't matter. If you are giving 100% justice to your previous camp, definitely this camp is not going to be a win. First. Second, suppose you have conducted one camp and a good ample amount of number of people came to our base hospital for surgery. And in surgery visit, in the base hospital, you have given proper treatment. That means every information you have provided and human touch was there. Food was good, shelter was good, everything, clinical procedure was good, family operation procedure was good, and vision is up to the mark. If your quality is proper, definitely people will search you, not to the other organization. So it depends whether in a single village, whether this is a 2 camp, 3 camp or 4 camp, that doesn't matter. If you have given proper justice to the previous camp, definitely this camp is not going to be a multi camp. This is my opinion.
Thank you, Jitendra. सागर जी, आप कुछ ऐड करना चाहते हैं?
जितेंद्र सर जो बोले मैं 100% एग्री हूँ। अगर एक कैंप हुआ है, हम दूसरा कैंप ले रहे, तो जो सर्विस हम दे रहे तो क्वालिटी अच्छा चाहिए, और जो सर्जरी जो क्वालिटी है वो अच्छा देने से पेशेंट को समझ में आ जाता है, तो इस तरह अपन टैकल कर सकते हैं। यस,
Thank you so much. I would like to thank all the speakers. I don't think we have much questions. Rather than questions, we have so many comments on FB about congratulating all the speakers for a very good session. So thank you all of you, and also I would like to thank management of Trilochan Netralaya and management of Akalkot Vision Center and management of Achyuta Eye Center for giving time for the optometrists to join our session. And also I would like to thank our board member, Ms. Elizabeth ma'am, who has referred optometrists for our session. And also my special thanks to my team members, Harshada ma'am and Sakina, who has been helping me in the back end. And lastly, I would like to thank Sagarji, Jitendra and Saravanan for making this session a very special session for me. This is my first session, and we have a lot of viewers on FB right now who are actually inspired, and also many students who actually got an idea about how serving community is very important, and also creating awareness about public eye health has reached out to students today. Thank you, everyone.
thank you madam.
Thank you so much, ma'am, for giving us the opportunity here, whatever we are doing for the community. Thank you so much from the core of my heart.
Thank you so much.
Thank you so much.
Thank you, everyone. So we'll end the session now. Thank you all.
Bye-bye.